Medical diagnostics is the process of identifying a disease or medical condition by examining a patient's symptoms, medical history, and test results. This process is critical in the field of medicine as it enables healthcare professionals to make accurate diagnoses, recommend appropriate treatments, and monitor the progress of a patient's condition. There are several methods of medical diagnostics, including physical examinations, laboratory tests, imaging tests, and genetic testing. Each method has its advantages and disadvantages, and the choice of method depends on the specific medical condition being diagnosed and the patient's medical history. Physical examinations are often the first step in medical diagnostics and involve a healthcare professional assessing a patient's physical appearance, vital signs, and overall health. This method can provide valuable information, such as the presence of abnormalities or signs of infection, but it is limited to what can be observed or felt by the healthcare professional. Laboratory tests are another common method of medical diagnostics and involve analyzing samples of a patient's blood, urine, or other bodily fluids. These tests can detect the presence of infections, assess organ function, and identify abnormalities in blood cells or other components. Laboratory tests are highly accurate and can provide crucial information for diagnosing a wide range of medical conditions. Imaging tests, such as X-rays, CT scans, and MRI scans, use advanced technology to create images of the body's internal structures. These tests can detect tumors, fractures, and other abnormalities that may not be visible during a physical examination. Imaging tests are particularly useful for diagnosing conditions that affect the bones, organs, or soft tissues of the body. Genetic testing is a newer method of medical diagnostics that involves analyzing a patient's DNA to identify genetic mutations or variations that may increase their risk of developing certain medical conditions. This method is particularly useful for diagnosing rare genetic disorders and can also be used to determine the most appropriate course of treatment for certain conditions. While medical diagnostics has come a long way in recent years, it is still not a perfect science. False positives, false negatives, and other errors can occur, and healthcare professionals must carefully interpret test results in the context of a patient's medical history and symptoms. Additionally, some medical conditions are difficult to diagnose, and patients may need to undergo multiple tests or procedures before a diagnosis can be made. In conclusion, medical diagnostics is a critical aspect of modern medicine, enabling healthcare professionals to identify and treat a wide range of medical conditions. With advances in technology and new diagnostic methods, the accuracy and reliability of medical diagnostics are continually improving, giving patients the best possible chance of a positive outcome. Thank you for viewing.